for me because you're literally down the street from me right now. We both live in Seven Hills. I should have just invited you over to the house. We could have just recorded this in
Right.
person. But you and I always have really interesting discussions when we go on these dog walks. We talk about philosophy, we talk about business, we talk about hormone optimization, training, nutrition, a lot of common interests. But one thing that's always intrigued me about you is you're a very young guy, you're a healthy guy, but you're also a cancer survivor. And we don't hear that too much. So I think sometimes people have the illusion that cancer is something that affects older, unhealthy people, but it can affect anyone. You could be as healthy as can be, and you can still be affected by it. There's plenty of examples of that. So I wanted to get into your cancer story a little bit, but let's start with when did you find out when did you find out that you had cancer, that you were diagnosed with cancer?
Right. Right. So I found out January 10th, 2018. Um, that was after a couple of months of just, starting to really feel pain, about 6 months when I started to feel lots of different back pains, leg pains. I was playing ice hockey and lifting weights at the time. So I just assumed, okay, well, it's probably injuries I've caused or whatever. Maybe I need to take a break. So then the pain started getting progressively worse to the point where I was popping Advils, like 2 Advils every like 2 to 4 hours. And that's when I knew, okay, I got to go to the doctor. Like I got to get this checked out. I started doing chiropractic at first to just make adjustments. Thought maybe that was because I thought that was all physical. And it's funny, one of the chiros I was going to highly recommended at the time, and he was doing this massage work on my abdomen, and he was saying like, man, your stomach is really tight. I feel like this is a lot of emotional trauma from your childhood, because this is usually where it happens, is right here. So I'm like, okay. He's like, yeah, we got to release it. So he keeps pushing in. I'm like, he's like, he literally said this. He goes, well, I don't see how else it could be tight. And I'm like, he's like, feel free to cry. I'm like, oh my gosh, dude. I'm like, I don't have any,
This is
I'm
in Los
thinking,
Angeles, right?
yes, yes. And I'm thinking so hard. I'm like, there is no childhood trauma that I can think of to any degree that is, I had a great childhood. I can't complain. So I'm like, yeah, I'm not feeling any tears, doc. And he goes, well, unless there's a giant tumor under there, I don't know what it could be. I mean,
Yeah.
and I'm like, wow. He goes, at your age, that's like next to impossible. And I'm like, yeah, I thought the same thing.
Yeah.
So that was like in November range. And then, things just kept getting worse. So then December, I finally made a primary care visit. They have to do the first visit where they just do the technicals. They don't go straight to a test right away. So 2 weeks after that, I'm like, hey man, I go back to him. I say to the primary care, and I say, hey, I'm in a lot of pain, man. We need to do something, because our first visit didn't really get anything done, because blood work came back all great also.
Right.
So blood work was great. So then he feels where I'm having pain. He goes, okay, let's do a CT scan. And I think that was like January 9th. I did the scan. And then the next morning, I think it was a Friday morning, they called me at 7:30 in the morning, and I'm like, uh-oh, to come in, for the results. I'm like, usually, those results take a couple of days to come in. You go in a week later, maybe, to review them, or they'll call you and say, oh, we didn't see nothing. But since they called me the next day to come in immediately, I was like, uh-oh. And that's when they told me that I had, that they found a giant tumor in the abdomen. It was about 15 centimeters large at the time. And that's when they said, like, okay, well, this is most likely cancer. We're going to do some more blood tests to look for some markers. And that's kind of how it started.
Yeah. Now, these physical pains you had, did they feel different than muscular pains, or was it similar enough that it was hard to determine?
It was very hard to determine.
Yeah.
Yeah, they were similar. It was a lot of low back pain, and it was on the left side. So like lower left up, like above the hip on the low back on the left side. So like below the kidney area. And then also down the left leg. So it was weird. Like I just did it. It happened really slowly over time. This whole
Yeah.
thing progressed slowly. They said it took years.
Mm.
And at one point, it was, so the tumor grew on the left side of the body. At one point, I couldn't even sleep on my left side. I felt like there was this pressure on my rib cage on my left rib cage, and I never noticed it. And I mean, I didn't notice like what was actually happening. I just slept on my right side, and I didn't think nothing of it, but there was definitely signs there. And if I do a little recap, there was another sign that I overlooked, which was I did feel something on the left ball in 2016. So about 2 years before, 2.5 years before I got diagnosed. And I decided to put essential oils on it. It went away
Just
mysteriously.
like a vesicule, or what did you feel over
It
there?
felt like a rock. Like
Oh, okay.
it didn't feel like a bump. Like there was no additional, growth. It was just a piece of the, you know,
Testicle.
felt, yes, testicle felt very hard. So I was
Yeah.
like, oh, whoa, that's weird. Um, so my mind, of course, went there, but I didn't think about going to the doctor to get this checked. I just decided to, I don't know why, I just decided to put some essential oils on this thing, and
Yeah.
mysteriously it disappeared, the rock part. So
Oh,
I'm
really?
like, oh, wow. Yeah, I put frankincense on there, which is, kind of known to be in the holistic world anyways. It's known to be like have some anti-cancer properties and
Okay.
whatnot. So I just thought, oh, let me put that on there, can't hurt, but I should have went to the doctor.
Yeah.
Um, and ironically, and then I developed this varicocele thing where that's like blood can't drain. That
Right.
was like a year later. So that was causing irritation and pain down there. And so then I go to the doctor for that. And then they do an ultrasound. This is like almost a year later from when I first discovered the left testicle thing. So they do an ultrasound and they don't find any tumors, nothing. And they just say, yeah, you have a varicocele, blah, blah, blah. Here's the treatment options. So
Right.
I just thought nothing of it, kept on going. And then that's when things started getting progressively worse with pain. And I just thought I tweaked my back. I thought, there's so many things I probably could have done wrong, deadlifting wrong, squatting wrong, playing ice hockey, getting, slammed. I've gotten hit pretty hard on the ice a few
Yeah.
times. So I just thought I was tweaked. And then that's how so it definitely did feel like regular pain. It was actual pressure on nerves and on the spinal cord, all that kind of stuff that the tumor created. And so you couldn't really tell that it was a different form of pain, I would say.
Yeah. Now, when you're diagnosed with it, what's going through your mind when you hear those words? You have cancer.
Right. Well, to my surprise, it wasn't I wasn't one of those people that's like, nah, you're wrong. Like you got the wrong patient.
Right.
Like, oh, like I took it hard. It was really hard. That was a really tough day.
Yeah. And you're 28 at this time.
28.
Yeah.
Yeah. Because what was going through my mind is it's weird. I've completely forgot. And I completely forgot to tell the doctor about what happened in 2016, about what I discovered. So my mind isn't thinking testicular cancer. My mind's thinking this is something else that's probably a lot worse. And
Right.
it already had spread to my lungs and to the liver. There was little spots. They were really tiny spots, but they were there. So my mind's thinking, okay, this has progressed. When something's progressed pretty largely, usually that's not a good outcome. It's not the result anyone desires. It's going to be a lot of pain and suffering, and then most likely, ends up in a death. So that's what's going through my mind of the options that I'm facing. And so, yeah, it was definitely a dark day, that's for sure. And yeah, it was just a weird thing. I just remember like not being able to control like little trembles in my just shaking because you're faced with this crazy reality. And so, yeah, my mind went dark, unfortunately. So
I think that's common though, especially for a young person because you just don't think think of it as a possibility. Did you
right.
end who did which doctor what doctor did you end up working with? Did you end up going to a specialist after that, or what were the steps after you got diagnosed?
Yeah. So first was blood tests. This was a lot of limbo right here. This between January and late February, there was about a month and a half ish of no progress. And things just got progressively really bad, really fast. Because the doctor that I did the initial discovery with, he tested me for a couple of different blood tests, and he found the markers that the main marker that was elevated, which was alpha fetoprotein, AFP. And that is one of two things: liver cancer or testicular cancer, nothing else. So he knew, right? He had a gut feeling right away to test me for AFP because of my age, and testicular cancer just happens to be the younger guy cancer, like 15 to 35 is the sweet spot for that cancer.
Yeah.
So he already had a weird hunch, even though there was nothing on the testicle that he was examining. He just thought, let's test for this. So, but he didn't tell me like what it's technically called a germ cell tumor. He didn't tell me like that's what it is, and that that's most likely what it is. And we need to get you to, someone who works with germ cell, which is testicular cancer, and we need to get maybe a biopsy and blah, blah, blah. He didn't do that. So he gave me like a kind of a doom and gloom type of vibe. And the other possibilities were sarcoma, lymphoma, which were both very bad. So as far as like prognosis. So I didn't take action through him because I didn't know what the next step was.
Right.
And then so I started doing I started reaching out to all the contacts I had in the health space, because I'm like, well, if I'm going to go down, I'm going to go down trying to beat this the real way, or like trying to really cure this, right? Rather than just go through terrible chemo, surgery, radiations, and just end up dying. So let me just patch into my network. So I got some people, found a couple doctors. One was in, I was in LA at the time. So one was in, I think, Orange County. It's a cancer center. Of course, insurance is not covered there. So that's a cash place. They had some cool, solutions that were unique and whatnot, but we still didn't know what we were dealing with, or they thought they didn't know what we were dealing with. They thought maybe it was lymphoma. They were still in la land. So there was no way to start any treatment. Excuse me. So
why wasn't anyone able to determine exactly what's going on?
Well, partially it was also partially my fault, because I did technically listen to people that told me not to get a biopsy because they said that's just going to make it worse usually. So I didn't get a biopsy. I delayed the biopsy. And because we didn't have a biopsy, no one, whether it was my first doctor or these new doctors, didn't know exactly what we were dealing with.
Yeah.
And so there was no progress for about a month and a half. One doctor had me buy like $4,000 worth of supplements, whatever it was. And it would look, my house looked like I had a pharmacy. It was so many supplements.
Yeah.
And dude, the guy wanted me to take like every supplement every day, multiple times a day. Dude, there was no way you could even eat food with the amount of supplements this was.
Yeah.
And so but I didn't know, my mind was totally in the wrong space to be able to discern what's BS and what's not, or what's the right thing to do and what's not. Because when you're in fear, you just can't see things clearly. You have no clarity. So finally, I make an appointment with City of Hope, and I start the relationship with City of Hope, and I go see a surgeon specialist first, and they review it with their board of people, and they say, look, we don't think it's sarcoma or lymphoma. This could be kidney cancer, because it was right by the left kidney area. It was right on it, basically. So they say, look, you just got to do a biopsy so we know. So then I did the biopsy with them. I ended up doing it. Ultrasound biopsy went really well. And then literally, I think it was like the next day we got the results. And then that's when everything changed right there, because I went from doom and gloom, it's only a matter of time until this is all over and I'm done with, to this is it. Like, we're going to beat this now. So it just completely changed because Bianca, she started researching, which is my fiance. She started researching testicular cancer, and she found a doctor at UCLA named Dr. Mark Litwin, who is like probably the top surgeon for this stuff. And he was actually a survivor himself. And I watched some YouTube videos that he posted, which was no matter what stage you're in, he goes, testicular cancer is 100% curable. And once I heard those words out of the doctor's mouth, that was it. It was game on.
Makes such a big difference when you come across someone who knows what he or she is doing and instills that confidence. I remember my brother had a really bad paragliding accident out there in Los Angeles. And once we started going to specialists, it was really discouraging initially because people would either have this doom gloom attitude. They're like, oh, I don't know if we're going to be able to save the leg. It's like, I've seen a lot of accidents like this. It doesn't go well. I was like, why are you telling a patient that? The many doctor, and then none of the common theme is that no one really knew what they were talking about. That was the feeling you got. And then finally we found a guy who was very well regarded in these kind of procedures. And the second he walked in the room, before he even started talking, just the second he walked in, I already felt better. I go, okay, now this guy looks like he knows what he's doing.
Right.
He just did, because he took one look at my brother's leg. He's like, yeah, you're going to need this. You're going to need this. He knew exactly what to do. He wasn't shocked by it. He wasn't baffled, like, uh-oh, what's going on here? He didn't have this alarmist type response where you're just making the patient feel even worse. So, I mean, it's so important when you're dealing with something serious, especially, that you find that person.
Right. Absolutely. Yeah. It's definitely huge, because if you don't, it's hard for you to do it yourself, to be in your own corner for you, because you don't have the expertise. It's kind of weird. It's almost like these doctors, and even I would argue lawyers as well, they have to have this like doom and gloom mentality a lot of times, because it's like they're almost paid to be negative. It's weird, like to look at the worst case scenarios. And so, but yeah, that was completely not how it ended up being. And so I ended up doing chemo at at City of Hope. And that doctor who ended up taking over my case, who works on germ cell tumor testicular cancer type patients, this is the craziest part. She's like, I don't understand why they had you do a biopsy. Like your AFP is supposed to be between like 0 and 8, depending on which range. Sometimes it's 0 and 6, 0 and 8, whatever. But mine was over 10,000.
Wow.
And she's like, you should have been at my office after they got this information, and we should have started your treatment like a month ago. She's like, I don't understand. We don't need to do a biopsy. She actually told me biopsies on germ cell tumors are actually not recommended. So she's like, yeah, this is crazy. Like, we should have already been started. So there's a lot of sometimes miscommunication in these things.
Why aren't biopsies recommended in this case?
For some reason with testicular germ cell tumors, they told me they just don't normally do it. It's just not part of the protocol. They just typically blood test you, because usually there's an obvious type of growth or something on one of the testicles. So it's like when the AFP's high and you have that going, it's just immediate. So first, normally they would do surgery to remove one of the testicles. Orchiectomy, it's called.
Yeah.
That's usually the first step. But because there was no signs of cancer there, they didn't do that at all at the beginning, because they were like, okay, maybe this is a different type, where one of the doctors explained it as when you're a baby, before they descend down into the scrotum, some germ cells could have got left behind, and then in that area, in the lymph node in the abdomen, that's when it turned to cancer later on in your life. But really what happened is it started in the testicle, and the pathway is usually it goes to one of the lymph nodes on your aorta.
Right.
And then it goes up from there to, lungs, then usually brain. So they did a brain MRI. There was nothing there, which is awesome.
Yeah.
But that's how. So I ended up doing the chemo there with them, and then I did surgery at UCLA. But I saw Dr. Mark Litwin, the surgeon, after my first week of chemo at City of Hope, and man, just like you said, like the confidence, like the guy comes in smiling,
right,
like so happy. He's like, oh my gosh, like don't even worry about this. You'll be done with this in a couple of months, and you'll be on to your, back to life. He was just so overly confident that it just made everything feel so much better. And all the pain I was in, by the way, literally went away. Gosh, like after literally the first night of treatment of chemo, literally
Really?
the pain just gone. No more back pain, no more leg pain. Got off painkillers. Yeah, there was no, um, after treatment started, that was the bottom, and then it was only up from there.
How long were you on chemotherapy?
That was about 3 months. It was on and off between February to May.
And what was your experience with that? Some get serious side effects. They feel terrible. Others seem to do okay with it.
Right. For me, it was actually pretty breezy. I can't say that it was a walk in the park, but I mean, there was a lot of stuff that was just like terrible. Like every week I had to get, one of them was weekly. It was a weekly dose, and that one it always triggers a weird response. And usually it'd end up with, high fever, chills, and like almost like a weird shaking where you feel like this weird bone pain. One of the side effects was bone pain. And that's the only real side effect I felt. Otherwise, everything else was pretty minimal, easy to mitigate with some medications. They had a really good protocol, City of Hope, to minimize side effects. And I didn't call it chemotherapy. I just called it healing therapy in my mind. So I just decided that this is not poison. This is, healing molecules or whatever. And that's just the mindset I went with. All the nurses liked it. They never came in and said, okay, we're going to do chemo. They would either play along and say, hey, we're going to do your healing session now. Or they wouldn't say. They would just tell me what they're doing and not mention chemo anymore. So it was actually quite an easy experience, I would say, in comparison to what most people experience. And some of the doctors told me it's only going to get a little worse from here. As far as like after my first round, they said, well, whatever you experience now, it's going to get worse from here. And then one of the other doctors I worked with prior, the one that kind of sold me a bunch of supplements, he said, oh, he has no idea what's coming. It's going to destroy him, And so a lot of doom and gloom, even amongst these people. And, but I'm like, look, man, I've already been at the worst case scenario, in my opinion, where I couldn't even eat because there was so much pressure in my abdomen.
Yeah.
From the tumor growing. And by the time I started chemo, it went from 15 centimeters to 22. It got huge. So I'm like, look, there's no way I can get any worse than I was. That was my mindset. And yeah, I mean, it's not something I would ever want to do again, but it definitely wasn't as bad as some people think.
Now, was removing the tumor part of the protocol as well at some point?
Yes. So that was, let's see here. Beginning of May, I finished chemo, and end of June is when I was scheduled for surgery at UCLA. They want to give you a break between chemo and straight to, surgery. So you let your body recover a little bit. And then I went in June, I think it was June 28th, 2018 is when I did surgery.
Had the tumor reduced in size from the chemotherapy?
Yeah, it did.
So you had some relief along the way.
Yes. Oh yeah, definitely. By midway to 3/4 of the way through, there was definitely a huge difference.
Yeah.
Huge difference, huge amount of relief. There was no more pain when eating. Now I can actually eat the calories that they wanted me to eat. So
how was your appetite affected from the chemotherapy?
It wasn't affected negatively at all.
Okay.
I actually gained a significant amount of weight at the beginning of starting the journey towards the end. I was like 115 at my lowest.
Yeah.
When you're got that negative mindset and you're not eating because it's painful and you're not moving. So I was laying down all day. So basically bedridden, you lose that muscle mass so quick.
Oh, yeah. If you're in that state for a week, you'll notice a negative response. For months, yeah, you're gonna get really depleted. What do you walk around at right now? What do you weigh?
Right now I'm about, I would say, just under 150, about like 145 to 150 range.
Yeah, so 115. Obviously, that's way lighter than you're ever used to being.
Right.
How did you feel day to day in terms of what did you find this whole process just sucked motivation out of you? Because you're a very driven person, you're a very purposeful person, you like to get things done. How did you deal with just the fatigue and everything else that came with this, the stress of dealing with cancer?
Right. Yeah. I just took it one day at a time, man. And I did notice, like, at the very beginning, there was a lot of fatigue. The fatigue during the first round was pretty bad. Like, it was just, man, it was hard to do anything. But
Yeah.
it got progressively better. Like, the fatigue went away more. I started doing more. Um, and but what's odd is I got in this really weird, like, state of mind where I became like this crazy weird consumer in terms of like spending money on dumb stuff.
Yeah.
And I became unmotivated to
Yeah.
work.
Yeah.
It was like quite the opposite. I'm sure, like, some people you'll see, like, especially in movies or something, like the guy's sick, but he really wants to push through, and like his desire to be, successful over, and then he doesn't even pay attention to his health type thing.
Right. Right.
But for me, it was the opposite. I was like, oh, I need to chill. I need to like just focus on healing and screw business, screw working. I don't want to work, blah, blah, blah. So it kind of made me oddly, in a way, lazy. Um, and I know my hormones and all that stuff was all jacked up. So I had this really weird I had no motivation basically to do anything outside of just focusing on my, just recovering basically. I didn't want any stress of business in my day to day. That's what I told myself anyways. Now I wish, of course, things were a little bit different. If I could change things, I wish I was a little bit more involved. But when I was in that situation, I was just so convinced that if I do like, things are going well, I don't want to ruin it by adding stress to my day and blah, blah,
Right.
blah. So I was really like weird. Like, I didn't want to do anything off the protocol, basically. I just wanted to stick to what's working and, you know, get to the finish line first.
Yeah.
So
I think that's natural though. You have to make that a priority. I wouldn't be thinking about my business either. I don't think,
right. Yeah.
well, those training goals that I thought were important before, I'd probably that would definitely go in the background real fast.
Right. Right.
Were
Yeah.
were you were you exercising at all, or were you just too tired to deal with any of that?
Um, at the very beginning of treatment, no,
Yeah.
maybe just walking. But then, as things went forward, I did start doing little things, more walking, and then eventually I joined a one of the gyms in that area and just started doing what I knew already, like just light training, light leg press, light
Right.
everything, just doing things to get the body moving. I couldn't do upper body because I had a PICC line in my right arm, and I don't know if you know what that is. Do you know what a PICC line is?
No, I don't think so.
It's like a deep permanent IV that goes in. It's not permanent, but it's a temporary thing. It goes into your arm, into your deep vein, and then it goes in up your shoulder, down your neck, and it ends up like it's in the vein that's like right on top of your heart.
Wow.
And so that's how they deliver the medication to you. It's almost like they have access. They also can withdraw blood from it.
Yeah.
So, like an open line to your internal body at all times. And it's
Wow.
got this, crazy patch here to keep it clean because it can get infected.
Oh
And
yeah.
they clean that one. It's called the dressing. They clean that they have to change that once a week. So you can't do anything too violent with your right arm because you can move or dislodge
Oh yeah.
the PICC line where it's sitting above your heart, and then the medication could start going in the wrong spot,
Yeah.
and that could be a big problem. So it was advised to be, cautious. Not They want you to move the arm so you don't get a blood clot because it is something else in your bloodstream, basically like a piece
Right.
of wire
Yeah.
or whatever. Um, but they don't want. I couldn't lift any weights, unfortunately. There was another option where you can put it on your chest and it goes straight in, but I didn't do that one. I didn't really know I was going to be lifting weights anytime soon.
Yeah.
So I wish I did that because then I could have done that too. But I did do what I could.
Yeah. So you go through chemo, you get the surgery. What happens after that? What's the recovery process after that?
So after surgery, this was actually probably the best part and the craziest part. So when the scans did, they showed the tumor did shrink, but it was still big, but everything else disappeared. So the spots on the liver and lungs all gone.
Yeah.
And right before surgery, they did an ultrasound again on the testicles just to see, just in case there's anything there. Well, this time somehow they find something on the left one. So that becomes part of the surgery. They got to take that out with the big tumor. And then the big tumor was also so lodged to the left kidney, they couldn't separate them. And so they had to take the left kidney out as well.
Wow.
So nephrectomy, orchiectomy, and whatever the tumor surgery, that's called RPLND, retroperitoneal lymph node dissection. Crazy. And so surgery, 6 hours long, goes massively well. Very good, high success. I wake up and literally like a couple hours later, the next day, like 12 hours later, they want me to get out of bed and start walking. Now that I didn't do because I'm like, no way. I don't feel, I'm like, I feel I'm in pain. I don't want to move. Like it was so weird. Like even touching my abdomen, like anywhere near the surgical site, it's like my body had this weird response and knew like, don't touch me. I'm hurting there. And it would uncontrollably flex the abdominal muscles. And the pain was severe because they just cut them. So it's like you don't want to laugh or cough after you get an abdominal surgery because of those obvious reasons. So, but they told me this crazy news. They do a biopsy on all the stuff they took out. It goes to, what do you call that? Pathology. And surprisingly, to their surprise, they found no cancer in anything. It's like, it was just completely gone. So they told me like, dude, you're like completely healed, man. Like there's no further treatment. There's nothing to do. There's just, you're done because we don't know what we would be treating you for. Everything came back negative. We have this giant tumor and nothing's there. We don't know what to make of this in a sense. So they said that was really good news. So from there, it was just, that was really good news. And then from there, it was just recovering from the surgery. And that was about a couple month process, I would say. You couldn't stand up straight at the beginning. It took some time. And then a couple months later, I'd say June, around September is when I returned to the gym.
And how did you, how long did it, you feel pretty good now. You've been training regularly for a while, but did it take a while to get on a roll? Was it difficult to resume training?
Yeah, I mean, a little bit. Yeah. I was really good at being patient and going light and doing things safely. So yeah, it was just really one little step at a time, little progress. Came quickly. The main thing was getting the main thing that I did was a lot of physical therapy, which was not, it wasn't through the surgical center or anything like that. It was all on my own, me seeking that out. I worked with the physical therapist prior to surgery just to make, like, maybe a couple months before I started doing it, just to get better flexibility, better movement, just all these things. And then when I got closer to surgery, they said, here's what we need to do when you get done with surgery. Because if you don't do anything, you might end up reducing a lot of your range of motion. Yeah. So let's be proactive about it. So I did. So I did a lot of the massage work and moving the scar tissue around.
Yeah.
And that was a little painful.
Important for optimal healing. Right. I had that nasty groin injury last year, and if I didn't get physical therapy, if I just sat around waiting for it to get better, not only would it have taken a long time, I don't believe it would have healed properly either, and it would be more likely to have a similar issue down the line, as opposed to you go to physical therapy, which can be really painful depending on the severity of the injury. But the good news is that once you get through that, you've induced real healing, so it's unlikely to be a problem again.
Right. Yeah. Yeah, definitely. That's definitely very important to do. I mean, to just let your body kind of do its thing is I guess like the lazy way to look at it, it's definitely recommended to take the proactive approach and take control of that. So
Yeah,
I
I
can't.
have to be proactive. I'm not someone, I mean, even when I have mild injuries, I go get work done because
Right.
I don't like feeling off. If I have some knee pain, I'm not going to be like, well, I'll just kick back for a week. It's like, no, why would I kick back for a week when I can go get treatment right now and be back in action minutes afterwards or by the
Right.
next day? It doesn't make
Right.
any sense to me. But I'm
Right.
someone who likes to be really physically active. A lot of people are sedentary, so they're probably thinking from their point of view, nothing's really going to change. They're sitting around anyway.
Right. Yeah.
They
Yeah. But they're
ignore
not
that.
really losing anything. And then,
Right.
I mean, and it gets to a point where you can't even walk or you have trouble walking. And it's like
Yeah,
now, like basic things just become so difficult. It's like,
right.
why did we let it get to this point in the first place? But,
Exactly.
you know, that's that's just poor lifestyle choices. And then you realize by the time you get to a point where you realize you don't have time now to fix it really. And that's like the wake up call of all this was for me is don't wait for old age to start anti-aging. It just
Right.
makes no sense.
Right.
So it's like waiting till you're a billionaire to spend money. It's like it's just stupid. It's just really stupid. So um
How
yeah,
would
that's
how has this whole experience with cancer changed your view on life? Do you look at things differently as a result?
I would definitely say I definitely do. I would say appreciating all the little things in life is a lot easier to do, and um, just having a lot more gratitude for every day, and also trying to live more with a sense of purpose. Because to me, uh, I believe a lot of the reason I went through that had to do with where I was kind of heading in my life. I was also going down some bad paths. I feel like I had some weird, I had some bad habits. I had some bad things, because business was pretty good, making good money. You could kind of get into trouble when you're young and making money.
Yeah.
So I feel like everything happened for a reason. To me, I feel like it was kind of like God bringing me back to center. Like, okay, you know, almost like I'm going to allow bad things like this to happen to you. I'm not saying, I'm not accusing of it being put on me on purpose. Like
Right.
I'm going to curse you with some cancer right now, but more like I'm not going to stop it either. Let it happen to you, bring you back to center, because that's exactly what happened. It brought me back to what mattered to me, uh, in terms of what I believe in spiritual and all that stuff. And, as a Christian, like I told you before, it just brought me back to that. And I think that had a lot to do with I think it had a lot to do with my progress in the journey. And so because of that, it makes me believe like, okay, there's got to be more of a reason I'm here than the reason I survived than just, I got lucky or something, or, whatever. So now having like a sense of purpose, I would say, would be more like the new way of looking at things now, ever since that happened.
Yeah, I mean, I've never experienced anything as severe as what you went through, but I've had some close calls with death, near death experiences, and I always came out of those just way more motivated, way more purpose driven, and almost as if you're thinking, okay, the clock is ticking. I don't have time to waste.
Right.
Or you're thinking, oh, I'll take care of that next week, or I'll make this happen. I became way more driven of I need to take charge of my life because you don't know how much time you have. So let's not waste a moment.
Right. Right. Absolutely. Yeah. Definitely don't want to be doing that. That's for sure. I mean, there's
It's
so much to do.
Yeah, there is. I think it's hard to value life when you haven't faced some kind of near death experience or some kind of serious health issue like you. Then you really appreciate it. Sometimes it
Right.
takes that to bring you
Right.
back to that center, as you said.
Right. Yeah. There's a weird quote. It's like, uh, you know, an everyday person wants XYZ, or wants more money. They want more success. They want all these things, whatever. But a sick person just wants one thing, and that's to be not sick,
Yeah,
So
yeah, yeah,
that's,
exactly.
yeah, it's queer. It's weird, man. I got into doing like this one type of yoga that was really more of like physical challenging. I just did a few classes of it, and I don't do yoga anymore now. But the teacher, I did it because I was friends with the teacher, the instructor, and he was a really cool guy. We hung out and stuff. And he would have these cool little things he would say during class. He's like, there's people in hospitals right now who wish they had the strength to be feeling the pain that you're feeling right now. Like they wish they could be feeling that kind of pain where it's like enduring it because you want to, not because you're feeling pain because you're sick.
Right.
You know?
Right.
And I'm like, I like that because it's like, that's so true. I remember that was me. And so it's like, I wish I could be feeling the pain of leg press or whatever, something that's so hard and that you hate doing. But I'm like, because it beats this pain for sure. Like this pain is involuntary. I don't like involuntary pain. So that was, that resonated with me. So yeah, definitely those kind of things are, like the sick person is just a very simple thing that they want is not to be sick.
Yeah. I mean, I look at physical training also as something that is a privilege. It's not a chore. See, most people look at it as a chore. So and when you look at something as a chore, what do? You try to avoid it by any means necessary. Anything that comes up, you use that as an excuse to avoid it.
Right.
If you look at it as a privilege, though, it's like I'm privileged that I can even go push myself physically, that I'm healthy, and that I can engage in an intense exercise or intense workout. Then you have a better mindset of valuing those things more.
Right. Absolutely. Definitely. Yeah. It's like I get to work out. I don't have to, you know, and that's so crazy.
And work out is a win already.
Right. I remember saying that to some friends after surgery. I'm like, dude, I can't wait to get back in the gym. Like, you guys better start now and I'm going to pass you up, you know what I mean? Because I can't wait to go, like, to be able to work out again. Like and I just looked at it from that perspective, and yeah, it's been like that ever since.
Yeah. Yeah. Sometimes you don't value physical activity until you deal with an injury. Sometimes you don't value your life until you deal with this life-threatening situation.
Right.
And I think that's why so many people get distracted so easily. I mean, one thing we were talking about before we started recording is that social media can actually have an inhibitory effect on motivation because it gives you a dopamine response for minimal effort. Just like television is the fastest path away from boredom, but because it requires no effort, it's not satisfying either. You know, even if you're watching a good show, it's fun for the moment, but you don't feel like you accomplished something afterwards. You know, so it's just a distraction, but it gives you that dopamine rush where part of you has the illusion that you did do something, and now you're less motivated to do something in the real world.
Right. Absolutely. Yeah, that's definitely huge. I mean, it sucks. Like I can't even, it's hard for me to watch anything anymore because when I do it, it's almost, you get this weird emotional attachment to what you're watching, and you almost will think about it as if it's some real thing, but it's not. It's a staged show. It's a recorded show. It's not real. And so, and then you'll think about it a little bit after it's over, like, oh man, the season's over. Got to wait a year till it comes back, or if it might be the season finale, it might be done. And now you're like, oh, like it's almost like those characters became a part of your week, every week, you know, part of your life. And I'm like, dude, that's just not healthy because they're not, first of all, it's all fiction, and they probably have some weird agenda to, you know, change the way I view the world by embedding weird things in there. And then I'm like, there's so much more beneficial stuff I could be watching. If I'm going to be consuming content, there's so much more beneficial things where I could be learning and gaining knowledge and gaining life. I mean, there's some potential life-changing advice out there. And it's like, if I'm gonna be relaxing at night watching something, I always watch something that's gonna be somewhat beneficial to the space that I'm involved in, the spaces I'm in. And so it's like, there's just not enough, there's no time to watch, like, binge Netflix anymore. I just can't do it. It's hard for me to do that. I'm not saying I haven't done it. It's just been a while since I have.
Yeah, well, that's a good thing, because I think we should all be looking to add more experiences to our life. That's the most important thing, rather than making more money to buy material things that end up in the garage and then end up at the Goodwill eventually. whenever I buy something, I always think, okay, what's going to be the cost to get rid of this down the line?
Right. Yeah.
A lot of times
Right.
I don't end up buying things if I think it through like that. I go, you know
Right.
what? After a couple of months, this is going to go in the closet. You're not going to use this again. And
Right.
I'm not saying I've never bought stuff that I don't use. That happens to everyone, but I'm pretty good at avoiding most expenditures because if you think it through like that, it allows you to pull back a little bit.
Right.
Because so many things, it's the more stuff you have, the more it just bears down on you too. So like
Absolutely.
people that are hoarders, right,
Mhm.
where there's just garbage everywhere. They can't throw away anything. Those are never mentally healthy people. The fact that that's what they're making their external environment says a lot about their internal environment.
Right. Yeah. No, it's to me like when I first learned about like minimalism, I thought that I already was kind of naturally that to begin with. Like I wasn't trying to be one. I kind of just was naturally like that. But then I kind of adopted more of that lifestyle as it went, as I learned more about what it really is. And I just like, if you want to figure out how, uh, how, how minimalism is beneficial, really all you got to do is think about the last time you had to move. And
Yeah,
moving
yeah,
is just
exactly.
that just makes it so difficult right there. I mean, like, most of the stuff, like you said, what's this going to cost me in down the line? And a lot of that, to get rid of it, is going to be when you move, you'll find out. That's when you'll find out, like, man, why do I have this? I don't want to have to move all this stuff.
Right.
And so, yeah, that every time I've moved, I'm like, man, this is like traumatic. Like I don't want to even think about it. But depending on where you're moving, hiring movers sometimes is just doesn't make financial sense if it's just down the street or something. Um, so yeah, that whole lifestyle became super easy for me to adopt because like I'm not attached to anything material wise. And because I'm not attached to any of the materials, it's harder for me to have liabilities. It's like I can just leave right now and go anywhere. And there's nothing like of value physically that I'm like, oh crap, I need to go back and get that. Like I can just leave and there's no loss in a sense. So,
Yeah. I mean, one of the things I do like to you do on Instagram is I like to see these videos of really scenic places all over the
mm,
world, right? Whether it's Colorado or Maldives or Jamaica, whatever it is, because that reminds me of how I want to get back to those kind of experiences once the world
right,
returns back to normal a little bit. Because those are the
right,
things, when I think about really fun times in my past, it's always based around an experience. It is not an experience of buying something. Like I don't think, oh man, that day we bought that big screen TV, that was one of the happiest days ever, right? But you're thinking, I was
right,
walking the beach in South Africa. It was amazing. The sun was setting and the weather was
right,
perfect. Or I was teaching a course and everyone's having a really good time. Now, these are all experiences that are impactful.
right. Oh yeah, definitely. That's definitely where my mind is at too. It's like save the money from all this stuff that I can acquire that's going to be outdated within, 6 months to a year, depending on what you buy, and save that money for these irreplaceable experiences that can be life changing potentially. I mean, just amazing. Like imagine like people spend thousands of dollars on something like simple as like purses or whatever, or just are things that like just crazy have no real benefit to you.
Right.
And you could have easily, that same amount of money can go towards a trip that you can't, I mean, it's irreplaceable. You
Yeah.
can't replace our experience. So yeah, that applies to having that low liability allows you to spend money on those things a lot more because you're not spending money on objects.
Yeah. You want to be a hoarder of experiences if you have to be a
Right.
hoarder, not
Right.
material
Right.
things. You have a hoarder
Right.
of, you want to see all these incredible places. You want to go do interesting things. I mean, during this whole shutdown too, and everything closed for a couple of months, I think you and Bianca moved here when in June? It was right in the middle of the pandemic, right?
Right. It was July. July 4th weekend is the weekend
Yeah.
we got here.
Yeah. So I think we were somewhat open up by then, if I recall correctly.
Yes. Yeah. When we got here, yeah, we don't remember any. Yeah, there was no lockdown. No.
Yeah, I think we were open by June, if I remember now. It was a couple of months though, where everything was shut down for a while. But I that's when I got into skateboarding because I started thinking about things I want to get into. I go, hey, you know what? I used to love skateboarding as a teenager. Let me get a board and see how I feel about that now. And then I skate every day since then. It's just all of a sudden because I wanted some interesting experiences. Like, here's a way
Right.
for me to still have some fun experiences. Is you can't go to the movies, you can't go to a show, and the casinos are not open, but you can get outside, enjoy the day, be more active. I mean, my activity level went up big time during the whole shutdown. For a lot of people, it went
Wow.
down sitting around.
Right.
Mine went up. I was working out more than ever. I was skateboarding. I'm walking the dogs. I'm just being active organically.
Right. Wow,
And I
that's great.
and I think that many people that are really into intense training, sometimes they think that's all they need to do. They go, I put in my 4 workouts at 45 minutes, high intensity. I'm good. I can just kick back the rest of the week. And I think those people don't never get the results they really want because you want those things. Training should make you healthier so that you can be more active in addition to training, not deplete
Right.
you so much where you just want to sit around in between training sessions.
Right. Right. Yeah. Yeah. That's not that makes no sense because most people who train, even most high intense people who train, such as like Navy SEALs, they're training to be ready at any moment,
Right.
not to be, oh well, we're resting, guys, hold on. Just don't come in right now. We're
Yeah.
we're on a rest day, Um yeah, it's you don't want to be so depleted where you're just yeah, you can't move and like, oh yeah, I went so hard, like my legs are broken. Like, okay, man, well, that's not, you're actually potentially causing injuries, micro
Yeah.
injuries, not necessarily healthy muscle tear or where you're going to repair and build.
Right.
Um, so that's another crazy thing that could happen from overtraining.
Yeah. Yeah. I mean, most people don't have the problem of training too much or they have to worry about injuries. It's more the opposite end. But for those of us who enjoy training, it's easy to cross that path.
Oh
And
yeah.
that's why I always keep putting out that whole deposit training concept of just leave a little bit behind. And I'll be honest, sometimes it's hard for me to do that too. Especially when I feel really strong, I go, let's just keep going. And then I have to consciously pull it back. And I think it takes a lot of discipline to pull things back when you're someone that enjoys the intensity of training.
Right. Right. Yeah. Cause it's almost like, you're in a competition with yourself at all
Right.
times and, or being naturally competitive. I would say as male, you're going to be more competitive naturally. And you're not competing with anybody else, but you are competing with yourself and you're in your own head. So, and you're doing those reps. I've got 4 more. No, I've got 5 more probably.
Right.
And, last time I did this much when I went for it, let me try to go for more. And it's also a measure of psychological progress in a sense in people's minds, I would say, where you think if you keep going or you go heavier, you've made progress. So, yeah, it's definitely a discipline to stick to that kind of style. I've noticed from doing it myself, I definitely do like it. Um, because it's not like I like having both. I like, okay, this day I'll try to push as hard as I can and do as many
Yeah.
reps as possible. But I feel like I like it like that to stop midway and just relax, take a 2-minute break and do it again and not
Right.
go past it. It feels good. It feels like I don't know how to explain it. It feels like I feel like some people want to rush the progress and
That's right.
more is not better. I mean, if it was, then that would mean there would be like why not work out all day? Just all day long.
Yeah, sometimes I remember when Muscle and Fitness used to feature movie stars or actors, their training regimens, which were always pure fiction, but you don't know that
Right.
as a teenager or a young man reading this stuff. It's some of the stuff you would read in there. I remember one was Mario von Peebles for this movie called Solo, right? It was this Terminator type ripoff movie. It was easily a forgettable movie. But anyway, his workout regimen, according to this issue of Muscle and Fitness, was he was bench pressing 315 for 5 sets of 15. 5 sets of 15. Now, as a young guy, I was like, wow, man, how did he get that strong? I need to find out this guy's regimen. And then a little bit later, you realize that's all made up. I've seen this guy in person before. He couldn't bench press 315 once if his life depended on it. Okay.
Right. Right.
Some people I can look at you and I can tell you probably how strong you are. And 5 sets of 15 implies that it's nothing too. It's like, yeah, I just did 5 sets of 15.
Right.
I mean, 1 set of 15 would be impressive. If he's like, yeah,
Right.
I worked up to 1 set of 15 with 315, I wouldn't believe that either. But that's in the realm of possibility, right? But 5 sets of 15, like it's nothing, that would
Right.
make you probably the best bench presser in the world at your weight
Yeah.
class.
Right. Oh, definitely. Yeah, definitely. That's crazy. That's crazy numbers in my opinion. That's just
Yeah.
5 sets alone. I mean, I'm sure you've heard of the bench press routine that people practice for strength, like 5 sets of 5.
Yeah, yeah, sure.
And
Very common.
yeah, very common. And that is very difficult to mentally get through. 5 sets of 5
Well, most
is
people don't even get that right either, because Reg Park is the guy who came up with that, right? He was one of Arnold Schwarzenegger's idols,
right.
in terms of bodybuilding idol. And the whole that 5 sets of 5 is really 3 sets of 5, because the first 2 sets are warm-up sets.
Oh, okay.
Properly. So 1 set, 2 set, and then you do 3 sets with the same weight.
Oh,
And
I see.
in my addition to that is what I like to do is, let's say in 3 sets of 5, I want to be able to do 7 on the third set. And when I can do that, then I increase the weight, as opposed to, yeah, I did all 3 sets of 5 with the same weight. Let me try to go for more next time. I don't think you're necessarily ready to go for more next time, especially if that last set were difficult where you barely got that 5th rep.
Right.
Let's make where you can actually do 2 extra credit reps. Now you're ready to move on. So always look at the set. And even then, like you said, I like to push it. I don't always do deposit training. I go through periods where I call it an intensification phase, where you ramp it up for a short period of time, maybe 4 to 6 weeks, to hit a particular goal or to accelerate progress a little bit. But when you're in that state, it's like being a high-speed train on the tracks, right? You can only maintain that speed for so long. So I mean, you're in the red zone and you're getting there faster, but eventually you have to pull it back.
Right.
And
eventually there's a turn coming.
Yeah, you want to be the one who pulls it back, not you got injured and now you have to pull it back, or you burned yourself out, your central nervous system is fried, and that's the reason why you're pulling it back. The problem is that when you're in that intensification phase and you're getting stronger every week, you start thinking how much progress you're going to make if it keeps going this way indefinitely. I go, man, 20 weeks from now I'll be doing this. But you're not going to be in this state for 20 weeks, though. You're going to be into it for, in my experience anyway, it's going to vary with each individual. I always find about 4 to 6 weeks, and then I have to pull it back. A lot of times, not even that long.
Right. Yeah. Yeah. No, for sure, man. Like, too much weight too quickly, your body, you don't know if your body's ready for it or not. You don't know, like, because everything else hasn't caught up yet, like your tendons, ligaments, those things. So yeah, it's especially in the younger guys world, like when I was doing heavy intense weight training when I was younger, it was always about progress of adding more. And it's like, well, eventually that's going to taper off, because you can't just keep getting, like, you're going to run out of dumbbells, and then, you know what I mean? Like you don't just keep getting that much stronger forever at the same rate. And like you said, you need to be at a point where you're able to do those reps now with ease, at the point where, like, you got those 2 extra reps you couldn't do before you move on to adding another 10 pounds on each side. It's just, what's the point? It's just, it doesn't make any sense. You're just going heavier for the sake of going heavier. You're not looking at the weight as a tool to do what you want. Instead, you're looking at the number of pounds.
Yeah.
And that's just, to me,
I think what gets a lot of us in trouble is we always look at barometers of progress. That's in the context of strength training, it's more weight or more reps, maybe more sets too. But it's usually more weight, more reps. So now if someone leaves a workout where they didn't do more reps or more weight, they almost feel like that was a wasted workout, or they were defeated, or they're getting weaker. But that's an illusion, because you're not going to have that at every single workout indefinitely. You're going to have it peaks and valleys. So just because you're not lifting more weight or doing more reps doesn't mean that you're not making progress. Your technique could be getting better. If your technique gets better over the course of 3 or 4 weeks, your strength is going to go up too next time you test it.
Right.
So sometimes you're making progress without realizing you're making progress, just by putting in the work, the consistency, drilling down the technique. Because whenever I lift something heavy, I don't want to just lift something heavy. I want it to look good too. So that means I prioritize technique. So when I see people posting clips where it's impressive how much they're lifting, but their technique is horrible, that to me is not as impressive. And I always think how much stronger that person could be if he or she cleaned up their technique, because they're
Right.
strong. They're getting away with it for now, but that
Right.
technique always leads to injury at some point. But if you have the discipline to pull it back and say, wow, I'm this strong with this crappy technique. Imagine how strong I could be if I really prioritized improving technique. This is what I did with the deadlift, why I got so much better. And the deadlift's an exercise where there's not a lot of room for error. You don't want to blow out your back or have a serious injury deadlifting. That could be pretty serious. So you
Right.
really want to take your time with that move. But there's a lot more technique to it than people realize. I mean, it sounds like a really basic motion. You just bend, you just make a hinge and you pick up a weight. But it's way more complex than that. There's a lot of timing elements. There's a lot of setup that you have to do properly.
Right.
People that are an elite level, believe me, they spend a lot of time drilling that technique. They're not just going, okay, my technique is good. Let me just focus on getting stronger. No, you can always improve technique. Technique can never be so great that it can't be improved.
Right. Right. Yeah. And that's um, a really good point. It's like almost like anybody who's anyone didn't get there by accident.
Right.
So like their technique is not, they're not that strong by accident. Like, oh, I'm just a freak of nature. I mean, every once in a while, sure, you'll have people who are gifted in terms of natural strength, but they're not where they are, strongest person in the world or whatever, because they just kind of throw weight around in the gym and just throw a bunch of chalk in their hands and call it a day, you know?
Yeah.
So,
Yeah,
yeah.
exactly. And then it allows you to get stronger in the safest manner possible, because if you're always prioritizing optimal technique, you avoid those sloppy reps. I mean, Charles Poliquin, he passed a couple of years ago, unfortunately, but he's considered by many the best strength coach in the industry. And one thing he would do with his clients is they wouldn't count reps executed with poor technique. So if you had a client doing an overhead press with 225 and first 5 reps look great, but the last 2 he was really leaning back or he's doing more of a push press, those reps aren't counted at all. And now he's incentivizing the trainee to not let it get sloppy, because we're not going to
Right.
count. So there's no point doing it.
Right. Yeah, exactly. Yeah. You're just hurting yourself for what?
Yeah.
What are you actually gaining? So yeah, all it takes is one slip up and you could be out permanently. I
Yeah.
mean, it could be that bad, unfortunately for some people. So yeah, it's definitely not worth it, or it's not worth doing it in that manner. It is worth pushing yourself, no doubt,
Yeah.
but not in that manner. So
That's the thing too, is that you can still push yourself. I mean, look, if you're training intensely and you're leaving a couple reps in the bank, it's still difficult. It's not like it's
right,
easy. It's
yeah,
easier than what you're used to, because you're used to training to failure. You're used to taking it to those intensification phases. So it's going to feel like you're holding back initially, but it's still difficult.
right,
But it's difficult without burning yourself out. So you can engage in that difficulty more often, and as a result, make way more progress and decrease the likelihood of any injury dramatically as well.
right, right. Which is ultimately not what you want,
Yeah.
because then you can't do it anymore. So you lose all the progress that you think
Yeah.
you've made, and it's like starting over. And I mean, that could be demotivating someone to the point where they give up forever.
Yeah.
I
It
mean,
can,
it could be really bad. I mean, I think I've seen people. I almost want to say like someone who, or someone online. I think I can't think of anyone specific, but someone who just like it kind of just left them like the desire to do it because they got injured, and it's almost like that guy. It's like
well, you're making all these negative associations now. So
yeah,
if every time you deadlift your back is stiff and you're walking around all hunched over, I mean, how for how long are you going to put up with that? After a while, you're going to be like, why am I even doing this? This is stupid.
right,
It doesn't have to
right,
be that way, though. You do it with optimal technique, or you do a modified version, you don't have any back pain. Or maybe
right,
it's not a good fit for you, you have to do something else. That's okay too. Because no
right,
one no one's going to deal with that kind of negative feeling for a prolonged period of time, especially those of us who want to be strong and physical. Okay, I want to be strong and physical. I want to move well. I don't want to be someone where every time I get up, my back is stiff and I feel tight walking around. No, that's not a fun feeling.
no, no way. Yeah, definitely don't want to be feeling like that. Don't want to be feeling like you're this old. Even when you are older, it's like you don't want to feel that way. Like I think it's avoidable. I don't think it has to be. I mean, there's plenty of examples out there
Oh
that
yeah.
show that it's definitely not. Uh, like you've seen those examples side by side. They're both 85-year-old women. One looks nothing like she's 85. The other one looks like, I mean, a legit grandma that's about to, just go to the next life. So,
Yeah.
it's all choice, and, why not choose the one that's going to benefit you, especially in the long term? Because I mean, another thing too is like when you're all that age, it's like, do you want to be dependent on somebody taking care of you?
Right.
And
Right.
you don't know, you don't want that until you're there. And now it's like like that's just another big driver for all of these things, uh, business, health, working out, being strong. It's like the regret that you'll have is, I think that's like the worst feeling you can have, because now you're out of time.
Yeah.
And that's like, man, I can't imagine what that's like. So that's another good way to, or another good reason to look at the, what's that word I'm looking for? Urgency, sense of urgency for these things, because of there's that day is always coming where the time runs out, and yeah, you can't take action no matter how motivated you are. You've lost the chance. So
I think lack of urgency is one of the main reasons why people don't succeed. Now, what prefaces that is picking goals that you don't care about achieving. That's the main reason why most people fail. I think number one, like, no, everyone would do it for a reason. It's like, no, that means you don't want to do it. So that
right,
you think someone else told you this is something you should work on, and you don't care about doing it, but you try it just because someone else said, hey, you should focus on this, and then you give up after a week or two because you realize, okay, I don't really care about achieving this ultimately. Like people that make
right,
these New Year's resolutions and then 2 weeks into it, they've already given up. It's because they don't really care about achieving those goals. Otherwise, they would commit. First of all, they
right,
wouldn't wait until New Year's. You would start sooner, and
right.
then
Yeah,
you would commit to the process and realize it's going to take a long time. But if you're trying to achieve goals that you don't care about achieving, subconsciously your brain's telling you, why are we even doing this? Just stop.
right,
You don't need to do this at all.
right. Yeah, and that just goes back to the easy dopamine thing, and they just fall right back into the trap, and you just, especially your youthful years is your easiest years to make all these progresses.
Yeah.
And it's like, why would you want to waste those, um, not having this sense of urgency, not doing these things, not sticking with it? And I mean, you could blame some of that for sure on environment. Some people's environments are quite toxic, um, with discouragement rather than encouragement.
Right.
And
Right.
that's unfortunate, because
Yeah.
you can't always control those
Right.
situations. Um, so yeah, it's very, very difficult for when that's the case. But thankfully, like, I've never had, in my experience anyways, a bad environment where I can't feel like I can't do something because of, the situation or the people that are around me. Um, it's usually always been the opposite, more supportive
Yeah.
and stuff. But some people might have that. That's an excuse, I would say, for a while, that you can use that maybe, but it can't be a 10-year excuse. It can't be a 5-year excuse. It can't be a lifelong excuse. It can only be, you know, I mean, assuming, we're here and in America where we have a lot of benefits and stuff. Other places, maybe they can't prioritize those things because they got to take care of, so many different people that can't eat or something. I don't know. But
Yeah.
obviously here in the States, like, that's why they make fun of it, the first world problems, because of the level of opportunity people have to have all this choice, and they spoil it.
Yes.
So that's kind of unfortunate there. It just goes back to the same thing, like the guy who's sick. Oh, what does he want? He just wants to be not sick. And
Yeah.
then if you're healthy, you should be abusing that, in a sense, abusing that you
Yeah.
have that vibrant health. Take advantage of it.
So true. When I had this horrible case of pneumonia in 2002, it's the only thing I wanted to get back was my health. I didn't care about being strong and muscular again. I mean, eventually I wanted that back too, but initially I just wanted to be able to breathe, be able to
Right.
move around and not feel terrible, because I had no energy. I would cough just walking around. It was horrible. And once I got treated and they took all this stuff out of my back that was causing a lot of all the buildup in the lungs and all that,
Hmm.
I felt better immediately, and right away I was relieved. I was like, oh,
Right.
thank God I can actually breathe again. But I also, while I was recovering, my sense of urgency increased big time because now I realized you don't have, not that I didn't know this before, but it solidified it that you don't have all the time in the world. And whatever you want to do that you feel is important, you need to make that happen right now, commit to that right now, not put
Right.
it off. So that
Right.
means if you don't have a sense of urgency, nothing gets done. I mean, just then you go in the procrastination mode and it's a slippery slope from there.
Right. Oh yeah, absolutely. That's a dangerous road, man. Dangerous road. It's the complacency road where you just all good. I'm just gonna chill out for a while, and a while turns into a couple of years, and then a couple of years turns into a lifetime, and it's like,
You
geez.
have to earn that ability to pull things back. In other words, that's okay when, let's say you're building a business in the first 4 or 5 years, you're just working 7 days a week and you're enjoying it because this is what you want to do. But after a while, you want a little bit more balance in your life. But you've gone through a process. When you're in that early stage, that's not when you try to look for balance. Now it's
Right.
let's commit to this process. Let's do what it takes to achieve these goals. And then down the line, we can pull things back. But the mistake many make is they wanna have the results of success without putting the effort to achieve it. So they
Right.
want that relaxed. And that's what makes things like playing the lotto enticing or going to a casino enticing or looking for some scammy way to make money enticing because you want to make as much money as quickly as possible with as little effort as possible so
Right.
that you can live with even less effort
Right. Yeah.
after you
Yeah.
achieve all that. And
Yeah.
that's you're not creating any sense of urgency, and you're also not programming your brain in a way where it's gonna fall in line with that.
Right. Yeah. That's the main thing is the brain programming because you can't. It's hard to undo those wires once they're too deep ingrained.
Right.
Where you destroy your incentive disincentive program. Like you want to be incentivized for positive things that are hard, that produce value, that are long lasting, and disincentivized to choose shortcuts, to choose easy, to choose whatever. Because if it's flip flopped, you it just doesn't work well. I mean, if for someone like that, it's almost worth, like, even for me, like there's some stuff I still want to fix. I'm not done for sure. I'm nowhere near like completely my brain being completely rewired into the proper format. So it's like I almost value doing something like I don't know, a week long trip in the wilderness somewhere where you just completely go away from all this stimulus and kind of reset yourself back to uh, what would be, what would you do in the wild? I mean, you can't just turn on your phone and look at social media to get dopamine. You're going to have to do something different because food's not coming from, delivered to your door anymore. So you got to maybe go, I don't know, hunt that food or whatever you got to do. So you're you're going to be more programmed to do something, that almost resetting your programming to seek these things that are hard and difficult as reward versus just easy, quick access. I mean, that's almost the downside of technology is everything's click of a button.
Right.
Um, so it's good. Convenience is cool, but it shouldn't be at any, like, okay, convenience at any cost. Like at anything, I want convenience. And I think it's just like if things just become so convenient, then what's the point of doing anything?
Yeah, exactly. It's just not,
So
you're not incentivized now. It's this, the easier things get, the less you want to do things as well. It's just the ultimate demotivator.
right, right. It's like eventually, let's create a pill that just solves every problem on Earth, and it's really convenient. If you have a problem, you just take this pill, and you wake up the next day, and every problem that you knew about was erased from your memory, and it's gone. And then everybody who knew that you had that problem lost the memory of it too, or whatever. It's just gone forever. So yeah, that could be. I mean, I don't know what the next level is of that, but I mean, it's probably going to be more in technology, right?
Yeah.
That could be a lot pretty invasive potentially, but all at the sake of convenience. But that's only, yes, there are some people that create these things because they want to be entrepreneurial too. They want to create things and they think they might be doing a good thing, but they're also doing it subconsciously in the response to what the consumer has been saying. Oh, we want more convenience. We want more of this. So they're just kind of responding to what the market's begging for.
Oh yeah.
And that's unfortunate. That's what business, a lot of it does. It's like you almost can't be mad at the business because business is just, it's that's why they say like it's not personal, it's business. It's just designed to make more capital gains, just more profit.
Right.
So it's merely just responding to it. That's why you'll see all these cheap foods, all these easy diet pills, stuff like that. It's merely responding to what somebody wants. Now, was some of that probably pre-programmed years ago and people kind of bought into it? Sure. But at the same time, like you can't blame that forever. You got to take responsibility for yourself.
Yeah, 100%. Well, let's do this, man. Let's wrap up with what you're working on now. What are some of the goals you're working on right now with your business?
Well, things right now, I would say we're working on different CBD formulas that I'm thinking about launching on various avenues online and also for wholesale distribution, different formulations that are pretty cool. Sleep, we want to try to conquer main pain points. So sleep, pain, and anxiety. We want to kind of stick with those top three because those are actually some of the most prescribed medications that try to solve those problems, but they're not really solving them. They're just probably making them worse. Right. So, yeah, we want to leverage the power of the hemp plant to try to do those things. So pain, and then sleep and anxiety, and that way it's like you have a daytime thing, and you have a nighttime regimen type of thing.
Right.
So, and yeah, we'll see how it goes, man. I'm testing right now. Got some goodies for you actually to try out.
Seen that, yeah.
Yeah. So yeah, we'll see, man. That's pretty cool stuff, man. And then there's the other thing that I may or may not be working on, which was the exosomes thing. I got a doctor friend who wants me to kind of help distribute these, but there's just so much on the plate right now with everything going on. And I've told you about my other printing business. That's just been not something I want to be doing, but it's also it's very fruitful, so I can't complain about it.
Right.
So yeah, wanting to focus more of my time on what I want to be doing versus what I have to be doing. And also just with different investments, all these kind of things, it's just been really, I don't know, I've been really pumped these last couple of weeks. Things have been really awesome.
It's awesome.
Yeah.
Glad to hear it. Well, cool, man. Let's wrap up there. And your Instagram is New Chris Becker?
Yes.
And you have a website or anything?
Right now, no website.
Yeah. So we'll just direct people to your social media. Well, this was great, man. Love talking to you. Always talking to you when we walk our dogs together.
Right.
Else, but this is fantastic. So let me go ahead and stop recording.